depending on what part of your respiratory system gets infected. So there are some diseases that are restricted to the upper respiratory system. That is the nasal cavity and pharynx. So that would be up here. Okay. There are other diseases that can go into the lower respiratory systems, the larynx, the bronchus, the bronchioles, and the lungs. So down here. Right? There are some pathogens which will infect both. Okay. And so we'll get into these different aspects as we go through these different pathogens. All right, so I'm going to go through some examples of pathogens that that go through the respiratory system and affect the respiratory system. And I'm going to try to focus on ones that you may have heard about or know about. So one that we often hear about is Streptococcus pyogenes, right? So the common name for that would be what? That's strep throat, right? So this is a causal agent of streptococcal pharyngitis. Right, so we're talking about right here. So strep throat is a common name for this. So with streptococcus pharyngitis, you have inflammation of the mucous membranes of the throat. Okay. This leads to laryngitis and bronchitis. Right, and the bacterial infection. So remember, this is bacteria. Bacterial infection can spread to the lower respiratory tract. Also, if untreated, this infection has some complications associated with it, which is the reason why if you have strep throat, you're supposed to get this treated early to avoid these complications. You can have scarlet fever. So this is where the bacteria releases a toxin, and that causes your skin. That causes skin redness. That's why we call it scarlet fever. Okay. There's a nice. So this is just a general comment about this particular unit. If you look throughout the diseases, you'll find these boxes, and they're particularly good at giving you a nice summary of the disease. So a good example of this is with the box for Streptococcus pyogenes. It shows you how it gets into the body. That's portal of entry. So the respiratory illness. And then it shows you, goes through an outline of what happens. So here we have pharyngitis. Then if it spreads, it can become laryngitis. It can go into the lungs. It can cause bronchitis. Right? There are toxins that can result in scarlet fever. So this is where the redness comes from. Okay. And then there's another outcome where if the antigens and the antibodies get into the joints, it can cause sort of arthritic pain. So that's known as rheumatic fever. All right. Then they show you kind of early stages of pharyngitis. All right. So I mentioned rheumatic fever. So this is another complication. This occurs in about 3% of the untreated cases. Okay? This is essentially an autoimmune response, an autoimmune disease. What happens is that the antibodies that your body makes against the bacteria, against Streptococcus pyogenes, they cross-react with antigens that are found on your cells. Okay? So you can find these antigens on your heart tissue. So you can get heart inflammation from this, endocarditis, for example. It can affect your joints. So you get arthritic symptoms. Also can affect your kidneys. Okay? In fact, there's another form of this. There's another complication. It's called glomerulonephritis, acute glomerulonephritis, which results from streptococcal antigen antibody complexes that form and now get to your circulatory system, and they end up clogging your kidneys. Okay? All right, so this can cause kidney damage. Okay, any questions about that? All right, so I mentioned the common cold, so let me say a little bit about this. First of all, there are different virus strains that can cause colds. right? That's one reason why it's still difficult to control. There's at least let's say 100 different varieties of cold virus. Okay, so it makes it very difficult to try to develop a vaccine, right? Just for that basis. The cold virus is also resistant to drying and detergents. Okay, so what that means is that for us is that often you can find this virus hanging around. Like if someone has a cold, whatever they touch gets contaminated with the virus. And so since the virus doesn't require a wet environment, it can actually persist on whatever it is that the person touched for several hours. Right? So it could be on the doorknob, phone is another place, cell phone is another one. Right? That might be one of the risks of sharing your cell phone. Okay? And so that's one reason why the common cold is so easily transmitted. This is, as a lot of you know, this affects upper respiratory tract, and the major virus that causes the common cold is known as rhinovirus. Okay? There are other viruses that can cause cold-like symptoms, but rhinovirus is mainly responsible for the common cold. And this virus is very prolific. Makes a lot of virus when it causes an infection, and you can find it in nasal secretions, and then from nasal secretions you can find it on your hands. Right? So it's a good way of spreading the virus. So there was this one study, right? There's this one study that uses that looked at some of the cold remedies. So what's one way to treat a cold, or what's one remedy you can use to try to treat a cold? Zinc. Okay, that's one that you heard about. There's another one that I think you can still find this. Echinacea. What is echinacea? Huh?
It's a flower.
Yeah, it's a flower, right? So it's an herbal remedy. Okay, and so there's a lot of individuals that claim that echinacea can have some antiviral properties. So they actually tested this. What they did is they got so the best place to do these kind of clinical trials is to go to a college, because you can get lots of students, and if you pay them a small amount, they'll still do it. Okay, so what they did is they got a hotel, and they gave each person a room because they had to stay there for a number of days, and then half of them they infected with the cold virus, and then half of them just got a placebo. They didn't get infected. Okay. Does anyone know how would you infect someone with a cold if you had to do a clinical study? You have to give them the rhinovirus. So how would you give it to them? Yeah. So what you do is you can get those pipettes that we use. You get a pipette, you fill up with virus, and then you just squirt in their nose. Okay. All right. So they strip it into their nose. Okay. So now and they don't know whether they're getting like just water, just saline, or whether they're getting the virus. Okay, so half of them get sick. Then half of them they give echinacea. Half of them they give like a sugar pill. Right? They don't know which one is which, and so what they try to figure out is there a correlation between how fast people recover, right, and whether or not the echinacea has any effect. Do you know what they found? Yeah, it doesn't have any effect. That's what they found. But one of the things they had to do was they had to measure, this gets back to what, this point, they had to measure how much virus, right? How much virus did each person, or how much virus did each person generate? So what's the easy way to do that? If you know that it's that this is one way that you can detect the virus. So what they asked everyone to do was to save their Kleenex, right? So when you blow your nose, you just, so they actually got all the Kleenex, and they analyzed the virus from that, right? In fact, I think they actually just weighed the Kleenex, right? So if you had a lot of virus, you can have a lot of nasal secretion, and so they can tell based on the amount of Kleenex that you're using. Okay, so That's one way that you can scientifically measure how serious or how much cold infection you have. Okay.
Is that supposed to also indicate their immune system? Because to me, like, you had just shown us the effects of the immune system, and if they're not taking that into account, you could have people with varying immune systems.
Right. So
that
so that gets into how they, and this is actually kind of relevant because when you give a drug to a patient, it's like, well, how do you know that this drug actually works? And so they go through trials like this, and the way they test that is they actually get a large number of people. So even if there's some variation in the immune system, right? They try to account for that by getting a large enough group, so they know that. Like throwing dice, they know that most of the time it's going to be okay.
It's the law of numbers.
The law of big numbers, yes, okay? All right, so that's how they do that. So, any questions about this? Okay, we're going to take a break now. When you get back,